Good evening, sir. Today's second article is on women uninterrupted. Access to contraception and abortion services must be continuous. So, access to the contraception means a controversial, and abortion services means terminating services must be continuous. So let us start today's second article. Among the more serious ramifications of the pandemic has been rather extensive, even if unintended, disruption of healthcare services. So, among the more serious consequences of this pandemic has a rather extensive, even of unintentional disruption of healthcare services. Normal life has been crippled by the restrictions flowing from control measures, and access to medical service has been infinitely tougher for a vast majority. So, normal life has been crippled means disabled by the restrictions flowing to the control measures, and access to the medical services have been infinitely tougher for the vast majority, means a big majority. The scale of the impact on women's life in only now being recognized as global reports of inability to access contraceptives and abortion services during the long lockdown warn of dire consequences, including unwanted pregnancies, increase in domestic violence, and maternal mortality. So, the impact of women's life is only recognized. A global report inability to access contraceptive and abortion services for during the long this lockdown have a very vast consequences, so including unwanted pregnancies, increase in domestic violence, and maternal mortality are some of these consequences. A recent estimate by Mary Stopes International, shortly known as MSI, said about 2 million women missed out on service between January and June. 1.3 million were in India alone. So, the MSI report said there are 2 million women who were missed out in the services between January and June, and in India there were about 1.3 million women. Okay. According to WHO, a recent survey of responses from 103 countries found that 67% reported disruptions in family planning and contraception services. So, according to WHO, there was a survey conducted, and there was a result from 103 countries that 67% of disruptions in family planning and contraception services. So, UNFPA projections indicate that 47 million women in 114 low and middle income countries would be unable to use modern contraceptives if the average lockdown continued for 6 months, with major disruptions to services, and an additional 7 million unintended pregnancies are expected to occur. So, the in UNFPA projections indicate that 47 million people in 114 low income or middle income countries will not be able to use modern contraceptive methods if this lockdown extends till more 6 months, and uh, an additional 7 million unintentional pregnancies may be expected to occur in these 6 months. At the heart of this issue is the bulk of healthcare services shifting to cater to COVID 19 related emergencies and lockdown disruptions. So, the bulk of more healthcare services are being moved to COVID 19 people rather than these pregnancies. So there is so many disruptions during this lockdown. India listed abortions as essential services under the lockdown, but the disruption of transport services hampered access to centers of care, and lack of awareness about these services being available during this period was a factor. So India have listed that abortions should be mm, essential service during this lockdown, but the disruptions in transport services were not properly accessed to centers of care, and lack of awareness about these services were being available during period as a factor. It is pertinent to ask if services to facilitate abortion and contraception were indeed available in the cities and rural areas during the period, despite being listed as emergency and thus allowed to remain open even during intense lockdown. So, it is pertinent, meaning relevant, or it is relevant to ask if services to facilitate abortion and contraception would indeed available in the cities, means will they be available in the cities and rural areas during this lockdown period, or despite being listed as emergency they'll allowed remain open during intense lockdowns. Almost 30% of respondents seeking an abortion said that clinic in their area was closed, according to MSI report. So, according to MSI report, 30% who have reported there said that their area hospitals have been closed. And further, a study in 6 states by the Foundation of Reproductive Health Services India showed a severe shortage of medical abortion drugs in pharmacies. So, according to 6 states report, foundation by the Foundation for Reproductive Healthcare Services, they have said that almost so many health services for the contraceptive methods and pregnancy have been closed. And for a country setting out to bolster its contraception and abortion service outreach, this pandemic and its lockdown have dealt a blow. So, for a country setting out support to support its contraception and abortion service outreach, the pandemic and its lockdown have dealt a blow. The need for contraceptive services remain high in India. Over 1 in 3 women, means almost 35%, reporting a need for contraceptive advice as per MSI study. So almost 35% women in this country need a contraceptive advice or abortion. Providing interrupted Providing interruptive abortion and contraceptive counseling devices and care services is essential to safeguard the reproductive rights of women and protect them from abuse. So, providing interrupted means uninterrupted means without interrupting in abortion and contraceptive counseling devices and care services are essential for the safeguard of reproductive rights for women and protect them from abuse. These services must continue through measures such as telemedicine, incentives to local clinics to open their doors, resolving drug supply chain disruptions, besides improving access to healthcare. So, they have to improve the access for healthcare and also open their clinics so that the drug supply chain disruption, besides, and improve these healthcare of women. And they have to provide these services continuously, such as telemedicine and incentives. For centuries that do not prioritize women's healthcare needs will bear the heaviest of burdens not so long after. So the clinics which do not prioritize women's healthcare will have to face the heaviest burdens not so long after. So the second article is about the women's abortions and pregnancies for the contraception methods. So all the hospitals are concentrating on the COVID-19 pandemic, means people who have COVID-19, but not concentrating on the women people who are pregnant. So healthcare should be open fastly, and there should be a contraceptive and abortion methods, and they have to provide health care for the pregnant women and take care of them so that they'll be healthy and the people will be healthy who are being born. So it is said that in India it is said that the people, means there should be abortion where it's very essential or necessary in this lockdown, because the child who is born will have a defection, maybe they'll have a defection. So contraceptive methods and abortion methods should be provided for the women so that they can do abortion. and all the healthcare systems have to take care of it, and one so many people women are going missed out, so they have to take care of it. Thank you.